ready? Okay. Hello, everyone, and welcome to another episode of the Veterinary Roundtable, the podcast where we answer your veterinary-related questions while having some fun along the way. If you enjoyed today's episode, be sure to leave us a review on your podcast provider of choice. And if you have any feedback to offer to improve the Veterinary Roundtable, please let us know. Because we are moving on up.
We have 2 more.
Do you guys know that show, Moving On Up?
Yeah.
No, I've heard it. Yeah.
She's going to say no because she didn't. Thank you.
Yeah.
She didn't even know who Mr. Rogers' neighborhood was.
What?
Yeah.
You don't know?
Oh, I know
Mr.
that.
Rogers?
I'm young, but I know that one.
Maybe
If I saw something.
Maybe we should sing it for you.
Wait,
I
can
don't
you
remember
like
that song.
can you put Mr. Rogers' Neighborhood on the flat screen?
That'd be great if we could just be like, look at this.
I can't think of how it starts.
I don't remember.
Won't you be
my
neighbor?
Yeah.
No, you don't know that?
Do you know the Teletubbies?
I mean, I never watched it, but I know what Teletubbies is.
Would be her genre.
Yeah.
Okay.
Those were after me.
You think they were after you?
I was Oswald the Octopus. Who?
They were before you mean?
Who's Oslo?
You came after. You came after the Teletubbies.
I said Oslo. No.
Yeah.
Well, I watched the Teletubbies.
Right? I mean, like, they were older by the time
I heard
you came
about
along.
them when I was in my teens.
Right. So they were there before you.
Yeah.
My thing was, I liked Barney.
Yeah.
Yeah.
Barney was my
You
thing.
know who Barney is, right?
Yes, I do.
The big purple dinosaur. Clean up. Everybody.
Oh my God. That was my favorite song ever.
Everybody do your share.
I was never
We
much
sang
of a
that
TV
all the
kid.
time.
I just like Oswald the Octopus. I named my bunny Oswald.
Hey,
That was
Arnold.
really all. Yeah.
We got
There's a
Hey
bunch of them.
Arnold, Cat Dog.
No.
Cat Dog's a good one.
I was into like the
Uh,
iCarly and stuff when I was a little
Rugrats.
older. Big Time Rush, Victorious.
What about Rugrats?
Yeah, I watched
Oh,
that.
Rugrats.
I
I
were
know what it is,
amazing.
but I never watched it.
Oh my God, Rugrats were
Oh,
hilarious.
I know.
okay. I'm
Okay, so
getting
we're
hot.
up. We're
I'm
up
not-
there. We're getting up there in the podcast.
I'm not
number,
well cultured.
in the reviews, so we're very
us.
happy about that because
We're going
Devyn
slow,
was
but
just asking the other day about what was going to happen to her. So
She really wants it to happen, so please make it happen. That didn't
who always
happen.
wins, the tortoise or the hare? The tortoise.
Are you calling me a
The
tortoise?
the rhyme thing. Right? Doesn't the tortoise win? Isn't that like a whole...
Yeah, that's the irony
yeah.
behind it.
That's the
she's
irony.
talking about a tortoise and a hare.
Okay.
Yeah.
What am I in
It's a
the
veterinary
equation?
podcast. Okay.
I also didn't ask a few days ago.
I know you didn't. I was just saying that.
Go with it.
Okay, so we're up to 149 on Spotify, 47 on Apple Podcasts.
Nice.
Our
What's
goal,
up with that?
Our goal is 100. on Apple,
100,
I think.
100 on
Apple.
Apple.
I figured
sometime
Apple
in
would
this
be more
lifetime.
popular than Spotify.
I know.
I know.
That blows my mind.
Oh wait, no, I actually
Is it for free?
I don't have Apple.
It's full free on both.
Oh.
I
Yeah.
think.
Could be.
Yeah, I don't use.
Usually you
Apple.
don't pay for podcasts.
Harrison,
Mm.
give us a thumbs up if it's full free.
Well, it's probably just
Yep.
to do with ads.
Thumbs up.
The thumbs up.
We
Okay.
can't see his
I
face.
don't know, man.
So I'm Dr. King.
I'm Courtney Allen.
I'm Devyn Fortune.
I'm Dr. Duckwall.
It's nice to see you guys.
Welcome.
And does anybody, you wanted to ask the question
What
about
question?
our scrubs. About our scrubs.
No, you did.
You did. Didn't you say you wanted to?
didn't.
If
say-
you watch the
I
podcast,
thought you said if you watch the podcast, you get a high five.
that would be me.
Yeah, okay.
Are we doing it?
Go for it.
Alrighty. If you happen to watch the podcast, because it is available for viewing on the YouTube,
Mm-hmm.
you have to figure out what is new besides our set, because we announced that last week, or whatever week that was.
Yep.
So if you guess right, you get a high five.
We'll give you a shout
We'll
out.
give you a shout.
We'll give you a virtual high five and a shout out.
Yes.
We'll all give it to you simultaneously at the same
Yes.
time.
Hmm.
So
Yeah.
we will check to see who comments
Kind of like
first.
this. Ready, guys?
Pachinga.
Okay.
Bazinga.
All right. That's awesome.
We
That's
should call the
awesome.
Red Hot
No
Chili
hints,
Peppers.
but we are on fire today.
Mhm.
You're not supposed to make it easier.
Oh, somebody get the water gun on fire.
We are hot tamales.
Yes.
Oh,
lot of other names.
gosh. Okay. So we had some inquiries.
We had some inquiries. I don't know. Okay, so here's the difference between Emily and I, Dr. King and I. I read it and I was
Oh, wait.
like,
What are you laughing about?
Okay.
Hold on. Devyn's asking a question.
I would pronounce
What
it
does it
inquiry.
Oh, inquiry. This brings up a good point. You do say things differently. Like, I'm not you. I mean, people
inquiry
in general.
versus inquiry.
Yeah.
I've never heard inquiry. Sounds like you're adding letters, but I mean, I'm sure you're correct.
Listen, I am a really good speller.
Let's look it up
So
on
am I. I was in
Google and
Spellbowl.
Everybody says
I was
everything
in
different.
Spellbowl, okay.
Okay, so
And I have a
inquiry.
ribbon.
Where's your ribbon?
Inquiry would be spelled with the
INQUIRY. Inquiry.
That was really good spelling bee. Like,
it's also on the paper,
etiquette.
so I
Can
don't
you use
know.
it in a
Well,
sentence?
I told you I've been through it.
I know. That's what I'm saying. That was really good. Like spelling bee etiquette.
What's the word?
Wait, we
when
skipped over
you
the
You
introductions.
break up the
Oh.
word
We introduced
in
ourselves.
syllables. What am I looking for?
We did miss a part.
You break up the word in syllables. What is that? Synonyms.
Syntax.
Syntax?
No, that sounds like a drug. Like when on the commercials.
Syntax?
Listen, I'm
Call your doctor
homeschooling
today
a
about
child right now.
syntax.
I know.
I think
I don't teach English.
I think
because
syntax is like the format of sentences.
You're probably right
It
again.
does it not sound like a prescription
What is the
medication on a
word?
commercial?
Anyway, it doesn't matter.
Well, we're supposed to talk about our event tonight.
I think
too.
everyone's
Oh, okay.
on the
Get to
same
the
page.
inquiries.
Wait,
Okay,
first
okay.
of all, we didn't discuss the changes
Wow.
in the podcast.
wow. Everybody has a lot to say. Okay. All right.
Huh.
One thing at a time.
Okay, regroup.
Okay. Regroup.
Yep.
Let's talk about the changes to. Go ahead, Devyn.
Going forward, we will be having weekly episodes and guest episodes once a month. So
That
you'll
is
be
really
seeing-
important. We totally skipped over that. Good
Yes.
point.
Yeah.
So you'll be seeing a lot more of us.
That's right.
Or
Or hearing more of
hearing,
us.
yes. Yeah. But exciting things coming.
Yes.
Yep.
Okay. That's good.
Okay.
What's
now we
next?
Can go on
Oh.
to-
What does everyone have planned for the rest of the day?
I don't know, Courtney. What are you doing?
What are you doing, Courtney?
Are you still cold?
I'm going to bingo.
No way I'm going to bingo.
Really?
You guys are
Where are you
dorks.
guys
Yes.
going to go?
I'm going to bag bingo.
It's designer bag bingo.
designer bag bingo. And you know
Okay,
me,
now I
I'm
really
going to
don't-
try and win a bunch of bags.
Heck yeah. You win
Do you
designer
actually
bags
get-
like Louis Vuitton, Gucci.
How?
If
how
I
do
win
you get
something, I'll
tickets?
give it to
Where
you
is it
guys.
at?
So my mom goes every year. So you buy a table or you can split a table with someone and then you sell the seats. So like my mom's going, my mother-in-law, my aunt, two of my mom's friends, and we all sit at the same table. And then if you win, you get a designer bag and they're real.
Where is this at?
It's in Carmel.
It
at
moved.
the
It was
event center.
yeah. It was somewhere
Okay.
else last year, but it's
That's
not
great.
cheap.
What
The
are
tables are not
the-
cheap, but I love
Yeah.
bingo.
Yeah, that'd be awesome.
it's
Do you
fun.
just
Fun.
get to play, obviously, round after round?
I think so.
So hopefully it's not just like a
Like
one and
like
done.
if the way I've done it before is like there's a round and then whoever wins that round you win you get it's you pick
Usually
this
it's a
bag or
raffle
whatever.
basket
Yeah,
or whatever.
Whatever.
Okay.
And then-
Well, best of luck, ladies.
Thank you. very much.
Thank you. We're gonna be
Wow.
rocking our
I,
Louis.
I expect poses and pictures.
Are you
later
all?
if you get
Did you
back.
dress up your table in spring theme?
My mom is decorating it.
Yeah.
I'm supposed to go with her, but I don't know if we'll be done here soon enough.
Yeah,
But she's
so-
decorating
you know what that
it.
sounds like? A great opportunity for content.
Content.
Another thing that we're going to be trying to create is
Yes.
social media pages for
slowly
the
working
Veterinary
on it.
Roundtable.
Yes,
Working on it.
Mhm.
we are.
So behind the scenes of what we do and what we talk about is actually going to be on
Yes.
said outlets.
Yeah.
Which means you'll
Next
get to
month.
see even
We
more
already
of
have
us.
some videos
Yeah.
quarried.
Yep. We
They
do.
might be too graphic. I don't know.
Nah.
It's
Nah.
veterinary medicine.
Yeah.
If you're watching
It's
it, you got to
fine.
know what you're watching.
We
you
can
know?
put an emoji on
Yeah.
the
Oh, yeah.
graphic spots.
Yeah.
There you
Yeah.
go.
Yeah.
That's right.
Mhm.
Okay, now we're ready for the inquiries.
Inquiry.
Okay. Wow. That was
Inquiries
stressful.
from the last episode.
Yeah, I was taking this as like a dig, but Dr. King was like, "No, they're just sharing information." So that's just the difference between us. I'm like, "Oh, we said something wrong. They're coming at us."
Negative Nancy.
Yep.
And
Positive Patty.
Positive Betty.
Coming at you.
They're from @Ricky Schroeder.
Yep. So number one, you should watch the podcast from last week if you want to understand what these are about. Okay, so from Ricky, I have had a female feline patient with urethral obstruction.
Yes. So have I.
Right. And we also had Dr. Dudley had a dog, female,
Mhm.
get obstructed, which was really weird too. So it's
Interesting.
possible, I guess, is the point.
Yes.
It's just as much
Not
less
as
common. How
common.
many
Much.
have you had in your career?
2.
I haven't had any so far.
Right. Yes. And I mean, we unobstructed her. It was fine. I mean, it
Yeah.
was not,
Mhm.
it was just annoying, but it wasn't like
Yeah.
anything bad happened.
Yeah.
But
Makes it a lot harder.
that's the reason why you run the catheter in a cystotomy retrograde and normal grade, because
Yep.
you may flush something down there. That's one way you'll end up with something in the urethra of a female. But then I guess you could see this person's probably talking specifically that the patient presented as a blocked female patient.
Yeah.
Mm. Yeah.
So
Passing urinary catheters in females are, especially dogs, pain in the rear.
yeah,
Ugh.
it's no fun.
Nope. Okay.
Second number two. Second number two. That doesn't make any sense. Okay. Never heard of cystotomy along with de-obstructing a cat. Recently, I saw a cat on social media have a permanent cystotomy with a port the owner drained and kept clean. I wonder if that will become a common option. They do make permanent cystotomies in production goats that have bladder stones and obstruction concerns.
I didn't know that was a thing.
Interesting.
Well,
yeah.
I think what he's talking about is urethrostomy,
Oh, I see.
right? In a goat, like in a male. So like if you had a male dog and he was obstructed and you couldn't relieve the obstruction because of the os penis,
Yeah.
then you might end up just making an open urethrostomy,
Yeah. That makes
right?
sense.
And they're just peeing out of that opening,
Yeah.
not out of the tip of the penis.
So is
They
it like a
use.
PU surgery?
Yeah,
or
but you
kind
don't
of?
take away any of the
Yeah.
anatomy.
Oh, I see. Okay.
You're just
I understand.
opening. You're just leaving an opening.
I see.
It's
Okay.
like a salvage procedure.
Yeah.
So maybe that's what.
I kind of remember it from school.
Yeah.
But male goats are really, really bad for this stuff. Like we saw a lot in large animal hospitals.
Another reason not to have a goat.
Yeah. Yeah.
Okay. So, and what is
Answered
he
the first point. Never
de-obstructing a cat with his. Well, I mean,
We
yeah.
stabilize the cat. We don't go straight to a cystotomy. But if we look and see all that crud in there, you don't have to. I guess that's the other point is, but I learned coming with and working alongside you that usually those just go hand in hand because eventually you might end up there.
There's a
Mhm.
reason they block.
Yeah.
Yeah. So then you have
Right,
to fix that reason
because
so you don't
of the
reblock
stones,
when you
right.
pull the UCath.
Yeah, as soon as you pull it, they're just going to reobstruct.
Right.
Mhm.
You don't have enough time, I guess, to leave the urethra open long enough such that the diets would dissolve the stones.
Yes.
Yeah.
Because you can't leave the urethra in for weeks at a time.
Yeah.
Right.
I mean, the
That's a
catheter
good point.
in.
Mm-hmm.
So, yeah, that's why we end up doing them a lot more frequently than what we used to.
Mm-hmm.
But
All right. You guys want to do number 3?
Sure, I got it. Uh-huh.
Okay.
Recent WVC DCM update. Any dog on grain-free boutique exotic ingredient diets is recommended to have cardiac BNP testing as a screening. And if they do have DCM secondary to diet, there can be improvement/resolution if early in disease with switching diets.
good to
Okay,
know. So
yeah.
at WVC, that must have been a new announcement.
Yeah. And
That's
that's
smart, though.
because what I was reading was that if they get DCM, then you have to start treating it as DCM.
Mhm.
So knowing that there can be improvement or resolution is
Yeah.
pretty good.
I think you'd have to catch it very early.
Right.
Yeah.
That's the problem is that you're screening them once a year.
Yeah.
Mhm.
So like what's happening the other 364 days of the,
Right.
like, what's to say that your pro BNP is in the normal range
Right.
this month and next month,
Mm.
but yet you're going to wait an entire another year to.
Mhm.
So I think that's why they say it's so hard once you find it to reverse it.
Yeah.
I suppose if you just got lucky and
Found
found
right
it
away.
like right away,
Yeah.
maybe.
Yeah, I'm not sure.
So,
Okay.
but yeah, that's cool.
We made
Thanks
a
for,
video on DCM with grain-free diets in the past few days. Dr. Ham, didn't she? She's
Ham,
made one.
did
On the
Ham?
All-Star
Yes.
Veterinary
Yeah, she
Clinic
just did a little
TikTok.
blurb about it, like
Go
talked
give it a
about it.
watch.
Okay. Cool.
Okay, shout outs.
Okay. Shout outs. Shout it out.
One thing you do you
Mhm.
One more time.
what's doing right in the world?
In veterinary medicine.
In veterinary
I guess you could do
medicine?
the whole world.
We could, but
Okay.
I had a really good one last time. I don't have a good one this time. I don't even have one this time yet.
I kind of honestly think of him on the spot. I'll be very
Harrison's
honest with
texting
you.
us.
Oh,
You said what?
I said I kind of think of him on the spot. She just said Harrison's texting us.
Oh. It's hard for Harrison to talk to us. He's all the way over on the other side of the room. What did
Yeah.
he say? Tell us. Devyn.
One moment.
What did our production manager say?
He's on the clear opposite side of the studio from us, behind a whole bunch of monitors, so we can't see him. Hello? Okay.
Okay. Yes.
Okay. He
I didn't-
sent us another inquiry.
Oh,
We're just
That-
switching all the way around.
news. Breaking news. This
This
happened last time. I love
Yes.
this.
Okay. Breaking news. Hit it.
It applies to the DCM convo. Says from I don't know. Okay, from Vital Vet Nutrition on Instagram. As a nutritionist, I respectfully disagree and think it's far more nuanced than that, and that formulation and quality control is way more important than avoiding ingredients. Also, if we are going to oversimplify and say stay away from grain-free completely, then a lot of veterinary therapeutic diets fall into that very broad and non-specific category. So what theoretical novel protein diets are we going to recommend to our patients? I think that we can give ever more specific and better advice to our clients and patients.
Ooh, good note.
Wow.
Ooh.
Yes. Okay,
Okay.
wait. I don't know.
We appreciate your
I
inquiry.
can't read without blowing this
Do you
up.
need
So
your
hold on one
readers?
second. Vital Vet Nutrition. That's the person who wrote it,
Vital Vet Nutrition.
right?
Mm-hmm.
Am I
Is that
thinking
a
of this
food
right?
brand?
They
No,
said,
no. She's a
I was just
nutritionist.
curious. Oh, okay.
So this is awesome because
Yeah.
she needs to call in so we can pick her brain.
Yeah. I mean, I'll be honest,
Guest
like I
episode?
just had this conversation yesterday with a client about veterinary nutrition, and I'll be like, or I was like, we don't get a whole lot of nutrition education in school. You learn a lot as you come out, and then all of a sudden there's all these thousands of diets, and then you're
Mhm.
like, well, crap. There's so many things out there.
Well, I do think that we did say that it's not an ingredient. Like, we don't know what it is.
That's
Like,
positive.
we
Oh,
were
I was saying
talking-
in general, not about last time.
Oh, okay.
But yeah.
okay. Yeah.
Carry on.
No, like because of what the nutritionist is saying. Like, I don't want to give the impression that we said that it's only these grain-free diets. Like, you know what I'm saying?
Yeah.
They don't know what it is. There's no consensus as to what is causing it.
Yeah.
But the thought is to avoid them. So why are they telling us to avoid them?
Mm.
Why are the powers that be saying,
Right.
listen, you should be telling your clients to avoid them? She's saying, what are we supposed to do then? Well, I'm saying, you're the nutritionist, so tell me what I'm supposed to be saying.
Yeah.
Yeah.
No, that's
Yeah.
true. Like,
Do you know what I'm saying? Like,
yeah, it's a
okay,
very
so
good
then
point.
what is it? What she did not watch the whole episode, just the podcast clip I uploaded. Thanks, Harrison. So we need to. This is really great. We need to ask if she'll be on podcast.
We need a nutritionist.
Wonder where she's based.
Let's see.
Yeah. Tell us.
But myself and other commenters told her to listen to the full episode as you guys answered a few of her questions and concerns. So, okay, that's why it makes sense
Gotcha.
then why I'm saying what I'm saying. And he's saying, oh, wait a second. She only listened to this one clip where we
Yeah.
talked about it. But we did, because I was like, did she
know,
not
it's
listen?
funny
Covered,
that because I saw that clip pop up of us saying stay away from grain-free diets, and I was like, I wonder if that's going to ruffle some feathers because it's just going straight to that. And if people don't listen to the full episode, then they're not going to know why we're saying that.
Right.
It did say it. There is a lot of different.
It
Oh, it
did,
did
yeah.
ruffle. Oh, we did.
It did
ruffle
ruffle some feathers.
feathers.
Okay, but I just love that she was willing to say something, though. So that's why, though,
Yeah.
we hardly ever get to pick the brain of a veterinary nutritionist.
Yeah, we really don't.
So
Come on.
But like, what
Come
should
down
we
to the
do?
veterinary
They're
roundtable.
telling
How
us
do
that
we-
this leads to this, but we don't know why. So just
Don't do it.
avoid it, right?
Yeah.
Like, why would we say
that's the
at your
thought.
own
But
risk?
her point is, what are you going to use for novel protein diets then? Because you don't have grain in it.
Yeah.
Or I think is what, and that is true. I mean, Hills, Royal Canin, they
Mhm.
have novel protein diets. So what are we supposed to use then?
Right.
We essentially are putting them on a grain-free formula,
Mm-hmm.
right?
Mhm.
Is it
So,
completely grain
duck
free?
and sweet potato,
And it's completely grain free.
right? Yeah,
And then the blue alligator.
right. So then she's saying, okay, but I don't think, my point is that I don't think that they know what's causing it, which is true because there's no consensus about what's causing it.
Right.
There may be some other ingredient in those diets that we aren't aware of that's causing the DCM.
It's just the
So
Yeah.
that's hence where avoid those
Right.
diets come from, because you don't know.
Right.
These diets have not been implicated in the
Yeah, 'cause there was
development of DCM, because the FDA put out that entire.
Yeah, I was going to say there are certain brands. There's a whole chart that says
Right.
which ones were.
Whereas these
implicated.
ones, what she's talking about, the novel protein diets from Hills, Royal Canin,
Yeah.
have not been implicated in the development of DCM.
Yeah.
Which is, I think, why people said there's something else in the ingredient list in these boutique, in these exotic diets that aren't in these other main production company
I see what you're
diets
saying.
that are causing DCM.
Which is to her point of quality control, why that's so important too.
Right.
Okay.
So, Vital Vet Nutrition, if you're listening, please call us so you can come on the
Yes.
podcast.
That'd
And
be
then,
awesome.
Yeah.
then
Need
we can
that.
pick your brain and you can help us be smarter.
Yeah. Maybe they have
Mhm.
more research that we don't know yet or something.
Mm-hmm.
I don't know.
And maybe she can help us give better, even more specific advice to our clients.
Yeah.
How to
And our
talk to the
patients.
clients. Yeah.
Or like give us
Okay, we'll
examples
message
of-
her afterwards.
Okay.
for sure.
Okay.
We just want to be better.
Thanks, Harrison, for that. That was
Always wanna be
great because it
better.
had to do with
Yeah.
our stuff we were talking about.
Okay.
But we never did get to shout outs.
Did anyone have any?
I think we just covered it by
I do
working
too.
together.
Yeah.
Let's all work together.
There we
Thank
go.
you,
That's it right there.
nutritionists.
People willing to say something. That's what I'm going to support.
In a nice way.
Not being
Respectfully.
afraid of conversation.
Yeah.
Because when you contribute to the pool of meaning,
Mm-hmm.
Wow.
Wow.
Wow,
What book
that
is that
was
from? That
was deep.
inspired.
I'm
Let
just
me
saying.
tell you.
I'm just saying. When everyone feels like they can contribute to the pool of meaning, you're going to have the best information and the best decisions and the best advice out there.
To make a
Here
difference.
she
So there we
goes.
go.
Ladies and gentlemen,
I
Emily
know.
King.
There we go. Okay.
Case collections.
Case collections.
Love this part. Who wants to go first?
I'm going to go first. I want to get it done and over with.
Okay.
Okay.
Okay. So we had a 9-year-old male neutered golden retriever come in. He presented for lethargy and he was kind of just moving slower in the mornings, the owners had noticed. Throughout the day, he kind of picked up a little bit, went back to his normal self for the most part. And then in the mornings, he also wasn't eating super great. So his eating habits had changed. He would have to go back to the bowl multiple times to finish his meals, which was unlike him. And then they also mentioned that he was kind of limping on the front end, not sure which limb it was, but just thought they should mention it. So we started with some x-rays and we did injectably sedate him just so we could get those forelimb rads and they can be as clear as possible. So the patient's still and whatnot. And then while we're there, we decided to take some abdominal rads because of the kind of slowed down eating, lethargy, just to cover our bases, and we were already there. And so we did not really see much on the forelimb rads. They were pretty unremarkable for the most part. I think you elicited pain on the exam. But then
Yeah,
the x-rays
it
were pretty,
was-
I just want to make sure.
I forget which limb it was now.
It was the
one of
right
front ones. He
front.
was uncomfortable
Yeah.
when I picked one up and bared weight. Yeah, he had to bear
Yeah.
weight anyway.
But the x-rays were pretty boring.
Yeah.
But then on the abdominal radiographs, my landmarks were a little too high up, so I didn't collimate the beam enough. And on the VD of the abdomen, I caught the caudal aspect of the chest on accident. And I was like, oh, well, that's not normal. I saw like something that looked like a mass. So I called Dr. Duckwall to look at him, and we decided to proceed with chest rads since, once again, we were already there. And unfortunately, there was a soft tissue opacity noted in the left lung field. And so we kind of talked with the owners about it, and they decided to pursue going to oncology to get a consultation because they will do anything for this dog. And so they've been there. And I think we got so they had a meeting with the oncologist, and she actually noted 3 different masses in the chest, unfortunately. So surgery is not an option for him right now. So I think they're going to do some further testing, and then probably proceed with chemotherapy. I think just depending on, because they're going to sample the masses to determine the type of cancer, and do some other workup things to see if it's spread anywhere else. And so we're kind of just waiting on more tests and to see the plan. And then I also wanted to note that this dog does have a history of mast cell tumors. They have been removed, but I mean, that could have been the cause. I'm not sure. And then he also has a cough that comes and goes for the past, I think, few months.
Okay.
It wasn't anything intense, but he does cough every once in a while.
Yeah, he had 2 cutaneous low-grade mast cell tumors removed last November. This coughing kind of hack's been going on, I think, for about a year. Dr. McDivitt was kind of on the forefront of this, and I just met this dog with the limping and kind of transformed into this.
Oh, I didn't know the coughing was a year. I didn't see that part.
Yeah, they were kind of working through it. And then the oncologist gave me a call yesterday, 2 days ago, and said that because there was 2 questionable ones. One was a very large one, and the other one was like actually in the same area as where he had an external lipoma, but obviously looking at the body wall and stuff, it looked like it was more inside the chest.
Yeah.
And so unfortunately we had talked through like, yeah, surgery is, if there's one and they can resect it, that's an option, but now it's not so much.
Yeah.
So we'll see what
But
it comes
hopefully
back
chemo
as.
will help.
Yeah.
If they're able to do it, depending, like I said, if it's spread or metastasized or what stage and whatnot.
Either way, we caught it a little bit earlier than we would have. So
Yeah.
I caught it on accident.
That happens. We've talked about that before,
incidental
where
finding.
somebody comes in for something and you
Yeah.
find something else, you
Yeah.
know, and it's like such luck that they
yeah.
came in for some other problem, but you were able to find, you know,
Yeah.
a more pressing issue.
Yeah, if I would have collimated just a smidge, I would have missed it. and we
Nice
would have never.
No, I know.
Wasn't me doing my job to the best of my ability, but
I know.
Yeah.
That
so
actually
fascinating.
reminds me of Oliver. Maybe I should switch my case
What?
to Oliver.
okay, okay,
Go
yeah,
for
do
it.
it.
Okay.
Yeah.
Okay. So this dog came in for a skin issue. Just a simple bald spot on his back. It had been there for a couple weeks. He works alongside a neurologist because he has seizures. He has a history of hepatopathy, elevated liver values, very high, like ALP is like 4,500. It's been worked up by us, but I don't remember. It was a different colleague, but nothing major. And then he's had his spleen removed. He's had a splenectomy, and he has heart disease
He's been through it.
and cherry eye surgery. Also, now that I think about it.
Recently. Wasn't
Yeah.
that like a year ago? Maybe?
Yeah.
Yeah.
Anyways, this owner's phenomenal.
Yeah. Love
She's
her.
like on point with her dog, knows when he's off. And so just came in for this essentially bald spot. It wasn't crusty. It wasn't red. It was not bothersome to him. So the neurologist was like, I think it's probably more of a like maybe Cushing's or hormonal issue. So follow up with primary care. So we were like, oh yeah, we're talking about maybe Cushing's because of his liver stuff too. And so we're kind of discussing on working that up again because he had tested negative for it a year ago. And just kind of finishing my exam. And I was like, there's a bruise right here. That's weird. So I'm like, I'm just going to keep looking, not say anything quite yet. I'm going to look and see if there's any more. Open up his mouth. He's got petechia, which is all over his gums. He's got bleeding in his mouth from his gingiva. And then there's just more bruising on his body.
Yeah.
And I was like, calmly, I'm like, okay, so we have this spot here. Did you notice this before? And she said, no, I haven't noticed it. And long story short, we did blood work and this dog had 8,000 platelets. And if you're listening, your jaw is probably dropped to the ground because you worry about spontaneous bleeding when they're less than 50,000, or is it 25,000?
I think it's 25.
25,000. And then the low end of the range that you want to have is like 148,000. So he had 8,000 or 5,000 or something. And so long story short, we proceeded to continue the workup. He also had anemia, which was regenerative at the time. So I was worried about either blood loss or blood destruction, but the rest of his blood work didn't really fit at the time with some, at least intravascular destruction, where we would see maybe some, intravascular. So bilirubin wasn't high, things like that. So, we started on high immunosuppressive dose of prednisone. We could not collect safely enough blood to submit a tick-borne panel due to, collecting blood for the normal panel, and then we needed more for the tick, and then he was bruising. So unfortunately, we just started on doxycycline to cover our bases, and then started mycophenolate, another immunosuppressive, and then also clopidogrel to help with hopefully no clots forming with those platelets. And he came in the next day to make sure the swelling in his limbs had gone down because he had some hematomas, and they did. I saw him again yesterday, which was 2 days after diagnosis of suspected ITP, I should say, because the owner was concerned he was acting off, panting. And thankfully, we just ran a PCV TP because it was too early to recheck platelet values. And his anemia level was a little bit lower, but like not concerning. It went from 30% to 26%. And there was no free fluid in his abdomen or chest. And his gums were actually like a light pink. And the petechia on his gums had started to improve.
Good.
So we're checking his platelet values tomorrow. And we're going to kind of go from there. History-wise, drug-wise, he's on potassium bromide and Keppra for seizures. And that's it, I believe, right?
Yeah.
So I don't really know what the inciting cause was still, and I told her that I don't have an answer yet, because we did run the Coombs test to look and see if there was at least IMHA, and it was negative. So
You also did a fast scan, ultrasound.
Yeah,
and
there was
find any
no free
bleeding in the
fluid, yeah.
abdomen.
I'm not sure. I don't know
Weird
the cause.
case.
Yeah.
Poor guy.
Hadn't gotten into anything.
He's
but
been through it.
How
Yeah.
old is he? Do you know?
He's only 9,
He's only 9.
and he's a Shih Tzu, I think.
Yeah.
So
He was super happy yesterday.
yeah, he's stable.
Yeah.
We'll say that.
Where'd
very
you find the
cute.
first bruise? I was curious.
On his
Never
belly.
asked.
Because he's a
Dark
black
colored
dog.
and-
And
yeah.
I mean, so you have to look at those.
You would have
at
had to like really get in. He's a little heavier and he's kind of low to the ground. So you'd have to be like, get under
Yeah.
his face. Or like
really got to get in there.
Yeah.
To be continued.
To be
Yes,
continued.
yes.
Mhm.
I like it.
Okay, well, mine is kind of short and sweet. We had a client bring in their new kitten.
It's a good one.
Bring in their new kitten just to establish care, but mainly to get some confirmation on its breed. They had paid $700 for what they thought was going to be a male Maine Coon kitten. But they had their suspicions, so they brought the kitten in. It's a Dr. Ham patient. She went in, and the first thing she noticed is that it's not a Maine Coon. It's like a tabby kitten, which, don't get me wrong, is adorable, but it's just like a light brown with some orange mixed
1
in.
pound.
Tabby.
Maine Coons are never 1 pound.
It's teeny tiny.
Teeny tiny. Okay.
And then she got into her exam, and then the next thing she realized is that it's a female.
Female,
instead of
not
male.
male.
So here we have the $700 female tabby kitten that they thought was going to be a male Maine Coon.
Oh my god.
And the owners were obviously disappointed just with the breeder or wherever they got the kitten from. Because they already had like 2 or 3 domestic short hairs in the house, and they wanted to save that last spot for the breed they wanted, a Maine Coon. So they were just discussing how they might like reach out to family, friends, see if anyone wanted the kitten.
There's $700 kitten.
Yes,
Yeah.
for real.
that you
Oh,
could have
God.
found on the
But-
street or the humane site
Oh.
for $10.
But one of our coworkers actually just moved into her own place, and she needed a friend, so she took the kitten in.
Oh,
Now
that's
she's
so
part of the
funny.
family. But yeah, $700 tabby kitten.
Oh my god.
Well, and it's just disappointing because I guess they were told that the hair that the Maine Coons have, like, distinct out of their ears and stuff, comes
Mhm.
in later on in life.
Yeah.
And then also it was a male, but the male parts are folded in up
Yeah.
on themselves in cats.
Okay, you know what? I have seen so many situations of the scamming with pets, purchasing of pets, and it started
Really?
like the tail end of COVID when everybody was,
Breeding
acquiring
in, yeah.
animals, and there were so many instances of fake, like websites where they would collect deposits and they would not be
Oh, yeah. It happened. I saw a lot
like
too.
a ton of it.
Yeah.
It's unbelievable that
Yeah,
people are just like,
And they would send you pictures of the puppies and everything. You put
Yeah.
down your deposit and then you never get your dog.
yeah.
That's crazy.
I saw that.
That should not be
that's
legal.
so sad.
Yeah.
Well, and then not to mention that all the animals, that are
Yeah.
whatever miscategorized and that
Yeah.
not wanted or whatever.
Yeah.
I hope those
Yeah.
people don't scam anybody else
I
and
hope
get
they-
somebody else's
I hope
hopes
they
up.
get a male Maine Coon kitten.
I do too.
Yeah. I hope they
Yeah.
do too.
We should
Yeah.
put them in touch with the Snyders.
Yep.
We should have told
Mhm.
them that. Give
Yeah.
them their breeder
Find them
contact
somebody.
info.
Yeah,
Yeah.
exactly.
Because they have beautiful Maine Coons.
They do.
Very
Okay.
cool. I'm going to give my case. I was going to do a case, but I'm going to do instead so we don't spend too much time. I'm going to do a case that, brought to mind a case. Okay, I can't talk. The case of a case of a case. No,
Yeah.
we had a shout out on social
Huh.
media about a cat that had eaten a
Mm.
foreign body that was,
I thought it was a dog.
It was a dog.
oh, it was a dog. Sorry.
I just figured it was
case-
like
my case is a cat,
Yeah.
but
Oh, okay.
that did it. But that Courtney and I were talking about it before the podcast started. She sent a picture in of the dog who ate all of these hair bands,
Mhm.
right? Basically,
Yep.
like gobs and gobs of them.
Threw up 15.
Threw up 15
home.
and then still had to have surgery
yes.
to remove another 50.
55. Yeah.
55.
Yes.
Oh my gosh.
55 bald
So
up.
grand total of 70 hair ties. I don't even own 70 hair ties.
Wow.
I know. Did they just keep buying more because they couldn't find
They
them?
couldn't find them. The cat that I saw that we ended up doing surgery on ended up with like 20 of the rubber hair ties,
Yeah.
and his stomach was so hard you could feel it on
Ugh.
the outside of his. So
Wow.
like when
Just
you
like
were
three little
palpating his
breaks.
abdomen, yeah, you could. It felt corrugated.
Wow.
It was the strain, and so it was distended when we
Yeah.
went in to do surgery. I mean, it was just full,
Mm-hmm.
and he just pulled them out.
I'm so lucky my cats are not like that.
People are
Yeah.
knock on wood.
I know. Yes, there would.
I'll be honest, at first
Yeah.
when I saw the picture, I didn't read it. I just saw the picture and I was like, oh, it's just it's an obstruction of parasites. Because that's also a thing. If they
Yeah.
get obstructed
Yeah.
from adult
Yeah.
parasites.
So gross.
And the hard thing too, when reason why I was going to bring up cats is that it's hard to make them vomit.
Mm.
Like they don't usually vomit. You can
Mhm.
try, but they're kind of like
We talked about that last
Yeah,
podcast.
when we like
horses.
spun it
Did we talk about?
around.
Yeah, yeah.
Well, Dudley's patient, they like sat on a spinning chair and spun around, and
Tried to
Yeah.
make it vomit.
yeah,
Yeah.
didn't work.
So
Cats don't. Yeah, cats don't.
They just don't
vomit.
like to.
Nope.
So
What's
anyway,
the medication
Stubborn.
you can give
thank you
them?
for sending that.
Yeah.
We use dexdomitor,
Just
dextomidine
Yeah.
to try, but
Yeah.
yeah.
it doesn't work a lot of
It
the
doesn't
time.
work.
Nope.
Doesn't work.
So
So you usually go scoping if you can, or
Yeah.
pray, or surgery.
or surgery.
Pray.
I pray for you.
Okay, let's go to listener questions. What are your thoughts on the new monoclonal parvo antibodies? What's your clinic go-to parvo treatment? At B Rat.
Okay, I love the monoclonal antibody stuff. I love that they're coming out with it. Not just this drug, all of it.
Yeah.
I love all of it. Every
Mhm.
single bit of it.
We haven't had to use it yet, no?
No.
It's not parvo season.
Wait, are we
Right.
talking about Panaquil?
No,
That's
that's,
for pancreatitis.
pancreatitis.
Oh, okay.
Yes.
Okay.
But the monoclonal antibody for parvo is I think that is it. Canine Parvo Monoclonal.
It's almost parvo
What's it
season.
called?
Yeah.
CPMA.
Okay.
Because it's on like conditional approval.
Gotcha.
Yeah.
So
I guess I was thinking pancreatitis when I read that.
yeah. So you can order it, but
Mhm.
I think that will be the go-to treatment.
I do too. I think we just had the rep talk to us about it, and just hearing, I don't remember the stats and I don't want to say the wrong thing, but basically it was impressive how they treated in their studies with just that.
Mhm.
And then I don't remember the timeline, but they were able to improve and do fine without any additional treatment. So
And I think the cool thing is that if you have a lot of times, unfortunately, when we're talking about treating parvo cases, it's so expensive.
Mhm.
Yeah.
Mhm.
And so being able to, the people that are having difficulty from a financial perspective, affording treatment for their dog, their puppy, being able to even just a shot in the dark, like you're giving this this is it. Like I'm going to spend my money on this
Yep.
and keep my fingers crossed. And those patients, I think, will be able to help a lot better than
think
what we
so,
currently
too.
were. So like our previous treatment was a combination of hospitalization with IV fluids, antibiotics, anti-nausea medication, sometimes pain medication.
Right.
Am
That's,
I missing
yeah.
anything?
Well, you can also do outpatient if the case isn't severe.
Mm-hmm. Is there anything else that?
No, I'm just thinking of the feeding, but usually we never had to do any like tube feeding or anything.
Yeah.
Which
You
is
just have to get
good.
them feeling well enough to
So
eat
it's just like
Yeah.
one IV
and
injection.
keep stuff down.
How long is it supposed to take effect?
Well, it binds right to the site, so it keeps the parvo
Yeah.
from entering the cell. So
yeah, so you have to also get it at
you don't
the
want
right time.
right. Like if your dog has been sick for 4 days, I don't think that's going to be an ideal situation.
Yeah.
Just through the beginning.
It would be great for a litter of puppies where a dog tested parvo positive, and then you've got these other puppies.
Mhm.
You'd be giving it to all of them.
Yeah.
You know. And so I think that's well, at least when I was reading, is that it binds to the site to keep the parvovirus from going into the cell.
So if a puppy comes in and they've been vomiting and having bloody diarrhea, do you give it to them? Or does it just depend on case by case?
I think you would still test for parvo.
Like,
you'd
and then
still
if the dog's super, super sick, you wouldn't recommend it?
No, I think they would still do it. I think it's
Yeah.
just more.
I see.
I think it's
but then you
more
might have to.
efficacious
Okay.
in-
I gotcha.
Yeah.
You know, it's more likely to, because with parvovirus, you're not, when we're treating them, historically, when we've treated them, we're not treating the virus. We're treating
No,
the secondary
yeah.
symptoms that the
Mhm.
virus is causing, and we're letting the
Just
virus
letting
run
it
its
pass.
course,
Mhm.
right? So that's already happening in that dog that's 3 to 4 to 5 days into the virus. All those secondary things are happening. So giving the drug, the monoclonal antibody, which is to keep the virus from doing what it's supposed to do, is
Mhm.
the train's already down the track.
I see.
So it's hard to slow it down.
Yeah.
Mhm.
So I think that's why they say the sooner you can give it, the better off
Yeah.
you are,
Mm.
you know, with those patients.
Mhm.
But would I still use it? Probably,
Yeah.
Mhm.
because it's not going to hurt anything,
Yeah.
Yeah.
you know?
Interesting.
Yeah.
Wonder how much it'll be.
It's for 8 weeks and older. Not that I wouldn't use it off label in somebody under 8 weeks.
Yeah.
It's supposed to be 8 weeks and older.
Yeah.
It's actually not cost prohibitive.
Good.
So, I mean, it's not like $50. Don't get me
Right.
wrong.
Yeah.
But I think
Not
If it
like-
works, it's
remember,
better
I
than
think
I don't
6 or
remember.
$700.
Not like Panaquil.
I'm sorry.
I said not like Panaquil. Like
From-
Panaquil is like
Panaquil.
Isn't it like
Panicle's
Or-
also multiple doses.
Yeah.
Oh, okay.
You have to use the vial, and it's 3
Oh,
consecutive
yeah.
doses.
Mm-hmm.
Mhm.
So
You have to give
That's
it
where-
multiple times in a
Yeah.
row.
yeah, you can't
it'll
just
be interesting.
It's not
seal
one
it
and done.
away. Yeah.
Yeah. But I think it's going to be huge for different
think-
parts of the country.
Yeah.
where
yeah.
they do,
Mhm.
or rescues or shelters where
Yeah.
then it spreads in a.
Yeah.
It could make a huge difference for those guys.
Yeah. I
I'm
agree.
excited.
Yeah.
I want to try it.
I think it's gonna
We
be
have
good.
it. It's got the great thing if you're listening is it's got like a really long expiration,
Mhm.
so you can order it, and I think
Just
it's like
have
either a 2 or 3 year expiration date.
Oh, that's
so
awesome.
yeah, so you're not out the product if you order it.
Yeah.
Well, stay tuned.
Yeah.
Maybe we'll have a.
What we did was we told the surrounding clinics that we had it, so they didn't order it. So then between the 3 of us,
Yeah.
then we probably will use it.
Yeah.
So
It's
then-
almost parvo season.
Yeah.
It is. It's almost
Mhm.
warming up.
Yeah.
We're ready.
Not this week.
Not that we
but-
want that.
Mhm.
I
But
know. So I think that with fluids, anti-nausea meds,
Yeah.
probably would be the treatment.
Yep.
Moving forward.
I do remember the representative saying that you still would continue your vaccine series though,
Mhm.
with your DAPP for your puppies and stuff. So,
Yeah.
I mean, because obviously they need the other parts of the vaccine as well.
Right.
They don't just need the parvo vaccine.
Yeah.
So yeah. Yeah,
More
I think you
input.
said what's your clinic go-to parvo treatment? So fluid therapy, Cerenia, ondansetron if we need that too. AD. I mean, you got to get a meeting as soon as possible to get the gut happy. So,
Yeah. Yeah. Very cool.
I don't
So
know
yeah,
what
these
else.
new products that are
cool
coming
with
out
that.
are just amazing. Okay, what you got?
We have more breaking news. This is distracting.
It says
Many.
He said many people have inquired about CPMA and said it's worked wonders. Many of the pet owner inquiries were concerned about cost of it.
I think that
So
if you're going to hospitalize a dog for parvo,
Mhm.
it's going to save you money.
Yes.
Yeah.
So
Agreed.
because you're spending money one way or another. You're either spending money on all these other things,
Yeah.
or you're spending money on the CPMA.
Yeah.
Mhm.
So you use the CPMA.
Use the
Yeah.
money wisely.
Yeah.
Mhm.
So
Yep. Agreed. Okay.
so cool. There's so many cool things coming out.
Go Vet Med.
Yes.
In a-
That's a
Innovation.
shout out.
What'd you say?
I said that's a shout
That's
out.
a shout out.
Vet
There you
Med
go.
growing.
Vet Med growing.
always
That's right.
growing.
Changing every day.
Is it
We did
USA
it.
only? Is it only in the USA?
Is it only in the USA? Unlike I would have to
doubt
look.
it.
I would
bet
have to
it's
double check
Europe
everything.
before it
That's
got
what I was
here.
going to say. It's always in Europe before it's ever here.
Labrella was.
Yeah, things
Labrella
are
was
always
in
over
Canada
there.
before here.
I think the restrictions are just softer restrictions.
Yeah.
So the FDA, I think that's the way it goes.
That was more breaking news.
More breaking news.
Wow.
Is the breaking news over?
Yeah, this is stressful. We need a better system for breaking news.
It needs to flash up on the
we
screen.
need
we need like a
earpieces.
prompter.
We need earpieces. Oh yeah, there we go. Exactly.
Yeah.
Oh,
Oh
And then
my
we could be like,
God.
wait, breaking news.
Wait, I'm getting something.
I mean,
Hold
I
on,
know.
one
Hold on
moment.
one second.
We're
What?
gonna turn into a news station.
Harrison from the studio.
Well, I think in all, this was a great podcast because we got some feedback.
We got
Don't
we
give away the answer.
discussed-
Oh,
We
okay.
discussed nutrition things, so we're
Mhm.
gonna follow up on that.
Mm-hmm.
Yeah.
Lots of
new
Ricky
stuff.
gave us some input
Thank you, Ricky.
or experiences.
Mm-hmm.
Mm-hmm.
Discuss the parvo drug. Anything else? I feel like it was a big day.
It was
Dr. King and I are going to Bingo.
And we're going to bag bingo, baby. Look
Win
out.
some bags.
This does not compare at all, but I've been missing my favorite chapstick for the past 2 months, and I found it today in the pocket of one of my jackets.
There we go.
So
That's
all.
like when you,
It's a good
put on
day.
an old
Yes.
jacket and you
Yeah.
find $20 in
Yeah.
it.
Mhm.
This is excellent.
yeah, I
It's
just
going to be a
noticed
good day.
soon.
That's
What
a way
about-
to
what
end
about
the
you, Duckworm?
podcast.
Anything?
I'm going
You've
to
been-
a baby sale clothing thing tonight.
There you go.
Baby sale.
A baby sale.
Not a baby sale. A baby clothing sale.
Okay.
Who's got her new slippers on?
All
Oh,
right,
yes.
everybody.
All right, let's leave. Thank you so much for tuning into another episode of the Veterinary Roundtable. Remember, send in those questions and leave us a review if you've enjoyed this episode or a previous one. We'll see you next week for another episode of the Veterinary Roundtable.
Thank you very much.